Hi, my name is Cassandra Matthews. I would like to do an ear, nose, and throat and eye exam on you. Can you tell me your name?
Alyssa.
Alyssa, is it okay if I do an ear, nose, throat, and eye exam on you? Okay, I like to check your band. Any allergies? Are you allergic to any medicines?
No, ma'am.
Okay, I have washed my hands and prepared for your assessment. So we're going to start off with your eye exam. I'm going to use the optometer that I'll be looking at your eyes. If you could just look straight ahead for me, I'll just be looking at your eyes. Just kind of follow my finger a little bit. Any kind of problems or anything like that?
No, ma'am.
No drainage or anything noted with your eyes?
No, ma'am.
Okay, I'm going to use what we call a Snellen's test. And it basically tests the acuity of your eyes, if you're able to see far off distances. What I just did was basically checked your optic nerve. And it was good. So now I'll check for 3 other nerves that you have, and like I said, we're going to use the Snellen's test to test those nerves. It's your ocular nerve, your trochlear nerve, and your abductus nerve. And to do that, I'll need you to stand up for me using this index card. If you would place one hand, and again I'm checking for those 3 nerves. If you'll put the index card over one of your eyes, and if you're able to read the letter that's on the wall for me, and I'll see if you're able to do that. Are you able to see the letter out of that eye? The
Yes,
eye that's
ma'am.
uncovered. Okay. Let's switch eyes. If you could do it on the other side. Are you able to see the letter?
Yes, ma'am.
Okay. So now you can have a seat. We'll go ahead and I'm going to go ahead and check your nose while we're there. And to do that, I'm going to put on some gloves to check your nose. And I'm going to use an otoscope. And that's basically going to check, your different areas of your nose. So I just want to check your, first of all, I want to just look at the sinus cavities to make sure that your sinuses are good. Kind of feel around a little bit. Have you had any surgeries, nose broken or anything like that?
No, ma'am.
Okay, just again, checking your sinuses. Okay, I'm just going to see how well you can breathe out of each nostril. So if you can inhale for me, breathe pretty good. Exhale for me, breathe pretty good. Okay. Now I'm going to, like I said, I'm going to use the otoscope, and it's also, I'm going to use that for your ears, but to look up your in your nostrils, just to see what kind, how your mucous membranes look up there. So if you can tilt your head back for me, I just want to take a look, kind of shine in your eye, shine in your nose, I'm sorry, and no kind of dryness, no problem with nosebleeds or anything like that. Okay, I'm just going to take this one and chunk it. And so now we're going to go on to the mouth exam. I'll be checking for 3 nerves in your mouth. I'll be checking for your glottis nerve, your epiglottis nerve, and your uvula nerve. Okay, so I'll be checking for those nerves while I'm doing your exam. So for that, I'm going to get a tongue blade here. And what I need you to do, I'm going to be looking at your teeth. Also, I'm going to be looking at your lips, the inside of your lips, just to kind of make sure that it's nice and dry or moist as well. So if you can lift your tongue out for me, stick your tongue out for me. And when I say ah, just say ah. Ah. Okay. All right. I'm just kind of expecting your mouth a little bit. I know that you have braces on.
Yes, ma'am.
Okay. All right. And your mucous membrane looks good. And I just want to assess your tonsils. So again, I'm going to grab another tongue blade here. And I'll just chunk this one. And I just want to check your tonsils. So if you're able to say ah for me real wide, ah, okay. And your uvula back there looks very good. All right. That's the little part that hangs down in your throat there. So now we're going to move on to your ear exam. I'm going to change my gloves out here because I want to look in your ears. So I've changed my gloves out. Again, with my otoscope, I just kind of want to look at your ears. I want to look at them first. Have you had any problem, difficulty hearing or anything like that?
No.
Okay. And your ear looks good. No kind of drainage. No, you haven't noticed any drainage in your ears. Okay. So again, with my otoscope, I'm gonna put the little tip on the end, and I'll be checking your ears. Okay.
Okay.
All right. So I'll lift up and pull down, look up and down, and your ears look good. And I'll come around on the other side, changing my little tip here. And I'll be looking at your other side. Going up and then down. All right. Okay, and I'll jump that. All right. So I'm gonna do a little test just to see how well you can hear. So I'll say a number in both one number in each ear, and if you could just repeat that number to me. Those are, we use what we call Weber and Ryan's test. The Ryan's test is more so with like a specular, or it looks like a fork almost, and it just basically tells how well you can hear the conduction of your ear in the inner ear. Have you had any kind of infections or anything in your ear? Okay, so basically what I'll do is I'll whisper, and that's a test, a letter to you, and if you could repeat it back to me, that would be great.
Number 1.
Okay.
1, 2, 3.
So you were able to hear okay? All right. All right. So that was basically, the ear exam. Now I kind of want to look at your, I didn't do one thing when I looked at your eyes. I kind of want to take a little Q-tip here. And I kind of just want to, there's a, check the nerve on your eye, the eyelid here. Just looking at your eyebrow. Okay. All right. So basically what we've done is I've looked at your ears, your nose, your throat, and your eye. We basically did those exams. Do you have any questions for me?
No, ma'am.
Okay. I'm going to take my gloves off and go wash my hands. It's important to wash your hands after you remove your gloves. So I thank you again for letting me do your ear, nose, eye, and mouth exam. Okay?
Okay.
Just stop it.